Welcome to Doc Talk with the Bakers. I'm Dr. Paul Baker.
And I'm Dr. Patrick Baker. We're the co-owners of Baker Chiropractic and Wellness. And we've been practicing here in Cincinnati for over 20 years.
We are on a mission to educate people just like you about the many benefits of chiropractic care. We want to show you how to escape pain from all types of health conditions without using expensive prescription medications or risky surgeries.
We want you to take control of your health and be informed about the options you have.
We see people every day who turn to us looking for answers after years of dealing with pain, enduring endless tests, and taking medications that leave them feeling numb. And we want you to know there is another way. So don't lose hope. All you have to do is simply ask us.
On today's show, we're going to be talking about spinal disc problems. That includes conditions like a slip disc, herniated discs, ruptured discs, and disc degeneration.
Disc problems are one of the most common reasons why people come to us looking for help. Our spine is a column of 24 individual bones called vertebrae, and in between each vertebrae is a small, round, flat, spongy disc filled with a jelly-like substance. Each disc is only about 1 inch wide and 1/4 inch thick and act as shock absorbers for your vertebrae and help keep your spine healthy and flexible. If one of these discs become damaged, let's view the disc like a jelly donut. The outer rim would be the bread part of the donut, and the inner portion would be the jelly. So this would represent a normal disc, a healthy disc. What happens when you get a herniated disc is the jelly part of the donut comes out, it protrudes, and it can pinch or put pressure on the surrounding nerves. And that can cause pain, weakness, or numbness. And in many cases, the pain can be quite severe.
And with us today is a special guest who can definitely attest to that, Joyce Smith. Welcome, Joyce.
Thank you.
Welcome.
I'm glad to be here. I hope that I can bring some insight to anyone that's out there with back pain issues, because I can attest to that. I've been coming to Dr. Baker for about 6 years now. I have been able to put off having a 3rd surgery for back issues, and I hope that with my weekly get-together with Dr. Baker that I don't ever have to go under the knife again. It may regress once in a while, but I go for my fix on each week, and I'm good to go.
Did you think that you couldn't get chiropractic care because you had 2 surgeries?
I actually had both physicians tell me not to have chiropractic help, that it would only damage what they had done to try to improve the situation. They said I had degenerative disc issues and stay away from the chiropractors, but I didn't.
Thank God you
Living
didn't.
proof here,
Right.
guys.
Thank God you didn't. And that's what we want to relay to the people out there watching today, is even if you've had surgery, there is still hope through chiropractic. And most of the time, your family physician or your orthopedic doctor will not refer you because they think chiropractic is damaging. But obviously, after 21 years of practice, we've seen many cases like yours be successful, which is fantastic.
Thank you.
And how has chiropractic care been different as far as your pain level when you had the back surgery and the different things that we do at the clinic to make you function at a much higher level?
It's been a lifesaver for me. I mean, I feel great. I've taken my bucket list and put it into practice and bought that little red convertible.
So Joyce, when you first came to see us, what was your pain level on a scale of 1 to 10?
I would say it was probably at the 10 level, and I could hardly sit down for more than 5 minutes at a time, and that's kind of hard when you spend your life at a computer. And after several months, I would say that pain level was at maybe a 3. So now, coming only once a week, I would say my pain level is almost 0.
That's wonderful, Joyce. Lots of things can cause spinal disc problems, and in fact, there's one thing that we all have in common, and that's aging.
As we get older, the decades of general wear and tear on our spinal discs can lead to a disc problem commonly referred to as a degenerative disc. That's why it's very important to keep your spine healthy so all the discs can stay properly positioned, hydrated, and functional.
Now, let's take a look at some of our viewer questions about disc problems.
Teresa asks, what causes a slipped disc? And is back surgery the only way to fix it? No, surgery isn't always necessary. And what causes a slipped disc is usually an improper lifting technique. Usually what happens is the person doesn't use their strong legs to bend over properly, and they bend their back too far forward, and that causes the disc to bulge backwards and pinch a nerve.
Kim asks, my legs and feet keep falling asleep. Is that a sign of a spinal disc problem? Yes, Kim. Basically what happens is the nerve gets pinched. It carries sensory fibers like numbness, tingling, and burning. So that's definitely a common symptom of a disc problem.
Terry asks, I've been diagnosed with a herniated disc, and I've been told that epidural injections are needed. Are the injections absolutely necessary? Terry, that's a hard question to answer unless examined. So what we recommend is you come in for an examination, we determine the extent of the damage. But oftentimes what we found in 21 years of practice, that epidural injections are almost always temporary.
Beth asks, I have 2 herniated discs in my neck that cause severe pain and I can't sleep. I've had the epidural injections, but they don't seem to help. I've also been prescribed painkillers, nerve blocks, and I even went to physical therapy. Now I get some temporary relief, but nothing works. The pain just keeps coming back. Is all hope lost? No, Beth, hope is definitely not lost. For example, Joyce just told us she went to several medical doctors, had 2 failed back surgeries. There's probably viewers out there today that are in the same situation and they don't know where to go. So hope is definitely not lost. Chiropractic was a great vehicle to reduce Joyce's pain to virtually 0 after 2 back surgeries.
We encourage you to ask your questions too. So take control of your health and get the answers you need.